Lovely, lovely. Oh, hi, Sandra.
Hi, I'm Hayley. I'm the midwife that's taken over from Teresa.
Oh, yeah.
How are you doing?
Oh, I'm just fed up.
I know. You've done so well, but hopefully we're going to have your baby soon.
Oh, I hope so.
Yeah.
I just can't do this anymore.
Okay,
I know.
sweetheart, I know.
You've had enough. I'm just going to give Hayley, tell her what's been going on with you, Katie, okay? So Katie's 32, she's 39 weeks.
Yeah.
She's in labour, she's had 20 hours and just failure to progress, 4 centimetres, 6 centimetres, 6 centimetres. She's just absolutely shattered. There's been the discussion and they've just said, you know, let's just do a section.
Yes.
So she's got an epidural. It's been working absolutely great. When she had it put in, there was some talk of blood staining on the catheter, but on aspiration, there was none.
Okay.
So, and it's worked really well. Now, the consultant who's just been in is give 10 mils of 0.5% levobuprofen, and but he's had to rush off to a Cat 1 section.
Angel.
Okay.
Yes, I know. You know, so hopefully then it won't be long. So he's just gone there.
Okay.
All right. So
have we got another anaesthetist on the way to come and do this section, or are we? Is it 2 filters?
He just said he'd come back. So,
okay.
So he said he'd come back.
He
just said he'd come back.
No, hopefully
he's just gone off. We'll just have to arrange another theatre because there was an emergency. So we'll probably go down to the downstairs theatres with you.
Okay.
Okay, but don't worry.
This is going to take. I just don't want to do this anymore.
It's okay. We're going to get your baby delivered as soon as possible, and you'll meet them as soon as possible. Okay. I know, you are doing so well.
You've done really well. And I've done OBS. OBS have been fine. So I'll just do another set of OBS after that top-up. So
okay.
We'll get that sorted.
A bit tingly.
Your lips feel a bit tingly. Oh dear.
Oh, that's different. She hasn't.
Let's do some observations on you and make sure that you're okay.
Is that normal? Should I have?
Well, it's a little bit unusual. Are you allergic to anything at all that you know of?
No, I'm not.
No. Okay.
No. Sometimes when I eat kiwi fruit, I get a little bit of a swollen tongue, but nothing else.
Oh, okay. Do you feel your tongue swollen at all? Do you feel like you're breathing normally?
Yeah, I've got like a weird ringing noise in my ears though.
Say again.
I've got like this weird ringing noise in my ears.
Ringing noise in your ears.
Ringing in your ears. Oh no, that's not normal.
What's the blood pressure?
What's our blood pressure? Oh, let's see.
Just do the observations, okay, and we should hopefully make you feel a little bit better. Got quite a high heart rate there. Just going to
shout out the observation.
Yes, we've got a heart rate of 114. We've got oxygen saturations of 97. Just waiting there for a blood pressure of 120 over 71. Okay, so that's normal.
Respiration, temperature?
Temperature, have we got a thermometer there, Teresa?
Yeah, temperature's 36.6.
36.6, that's normal.
Hi Katie, my name is Sandra and I'll be the scribe just documenting.
All right.
Sandra's just my assistant while we wait to
Thank you, Sandra. You don't feel right. Oh,
you don't feel right.
That doesn't seem right, does it, tingle?
No. Let's should we get an anaesthetist in the room to review because of this top-up that's been given and really we need an anaesthetist.
We'll ring for an anaesthetist.
What I'm going to do is
do you just want the anaesthetist, Hayley? Do you just want the anaesthetist?
And another
switchboard. Hello, can I get the anesthetist in the room? Which room are we?
Swim suite.
The swim suite. Immediately, and the doctors. And can I get another midwife as soon as possible? Thank you.
Very well. Okay.
An anaesthetist and a doctor's been called. Preferably another midwife, but I think they're just a bit busy out there.
Hi. So this is our lovely lady who's waiting to go to theatre for a Cat 2 section for failure to progress. So first baby, she's had a very long labour. She's not feeling very well at the moment. Her observations, her heart rate is slightly raised, but everything else is within the normal parameters. However, she's having some tingling of the lips, feeling lightheaded. And just generally feeling a bit.
That noise in my ears is.
She's got her ears are ringing, and she's got. She's just feeling a little bit lightheaded. Okay. She's had, I presume, an epidural top up in the room. She's got a good working epidural. However, there was some blood staining of the catheter when it was inserted. However, it's worked well so far.
Should we check clean on aspiration?
Yeah. Should we check what the epidural block is?
Brilliant.
Then there's a spray there.
We've got a cold spray. Okay, sweet. So what I'm going to do is I'm going to spray up your side, and I want you to tell me when it feels cold. So I'm going to spray it onto your arm.
Okay.
There.
Oh gosh, that's cold.
Yeah, and then I'm going to spray it up the side of you. So I'm just going to lift this blanket here, okay? So as I spray up your side,
Oh,
you're
right
feeling...
where my belly button is.
Say again?
Right where my belly button is, it feels cold.
It feels cold here, where your belly button is. Okay, so the block doesn't seem too high. Is it definitely cold here under your rib?
Yeah.
Yeah? Okay.
So with that history, I'm a bit concerned that we may be looking at LAST. So I think let's prefer maybe getting that drip back in if you're happy to do that.
Yeah,
So
to make sure we've got...
out. Yeah, and what I'm going to do is go and get some drugs. Are you happy with that?
Yeah, that's fine. So I'm just going to pop this cannula back, pop a cannula in.
100 mils in a 50 mil, two 50 mil syringes of 20%.
She is 70 kilograms. I've popped a theatre, it's just round in theatre, the Intralipid. I'll
That's
go back.
brilliant. So we've got IV access there in a wide bore cannula.
That's awesome. Someone's going to get my drugs.
We've got an airway management trolley there if you need it. Do you want to lay flat?
I've got the box here.
Oh, right, so
The policy is within the policy is within it.
feel better.
Yes, it's 100 mils. She's doing it.
She's 70 kilograms, so it's
Our blood pressure's dropped there,
Oh,
79
wow,
at 29, and the heart rate
she's got no pulse.
absent. She's got no pulse.
She's got no pulse. There's
We
the
need to
Intralipid.
Thank you.
get
Do you want me-
double
do you want
two,
to-
please, cardiac arrest.
Yes, perfect. Someone's doing it.
Do you want me to give the
I'd
Intralipid?
like you to give that Intralipid over a minute, what you've got in your hands.
Okay.
I'd like you to start CPR. I'd like you to lead the arrest and consider that we're going to deliver baby at 4 minutes, okay? Hand it over to you.
Doc, would you bring the cardiac arrest trolley over?
And we'll get some more team to take over you in a second.
It's okay.
Intralipid's been given.
That's fantastic. Can I confirm that's 100 mils in?
That was 100 mils given over a minute.
So do you, yeah.
Would you like
And-
these leads put in
Yes,
on?
please. That'd be fantastic. Thank you.
It's 237.
Okay, perfect. So I want you to lead this cardiac arrest, okay? So we've got DFib pads coming on. We'll see what rhythm she's in, see what rhythm check we are doing at 2 minutes, and I'll hand over to you to lead. I've given my Intralipid. Obviously, we think this is a local anaesthetic systemic toxicity, but we shouldn't be ignoring other differentials, okay? Consider the baby's also still in utero.
Do you want me to
your left hand.
I'll just tilt the uterus. I've got some more Intralipid here.
Fantastic.
The policy is there.
Thank you. So we're going 100 mils
Yes.
at 5 minutes, which we're not at yet. Going to give a repeat bolus of the same dose, so another 100 mils in 2 minutes' time. Are you happy to do that?
I'm
Okay,
happy to
fine.
do that in
Perfect.
5 minutes. Is there any, I think you could give an IV infusion there as well.
That looks good. Thank you for letting me know. IV infusion of lipid emulsion at 15 mils per kilo, so we said she's 70. So let's go for 17.5 mils as it says per minute. You have to set up that
Okay, I'll set that
infusion.
infusion. And Doc, could you just be tilting this uterus?
Have we got a wedge?
infusion?
We could put a wedge in, couldn't we, rather than manually
Free you up.
displacing the uterus so that we can free the doctor up. Sandra, have you got a wedge?
I'll get
can
a
we
wedge
just-
for you.
No, not a wedge.
Great, thanks.
Intralipid infusion commence.
That's fantastic, thank you.
Okay.
Could just use that as a wedge.
Use a wedge here.
That's awesome.
Wedge in situ.
There we go.
Okay, so
Wedge in situ.
are you alright to tell us when we need to do a pulse check? 'Cause I think we're coming up to the time, and I'll look at getting definitive airway as well.
Yep, that's fine.
Perfect, okay, so see what the rhythm is. I'm feeling for a central pulse. Might be on
Looks like a pulse has come back.
Fantastic. Have I got a pulse?
Yes,
I've got a pulse. Good job, guys. We've got Ross at
116.
time equals X.
End of scenario.